Hi, my name is Dr. Robert Davis with Active Health Complete Relief Care, and I'm here to continue answering your frequently asked questions regarding Trigenics and chronic degenerative knee pain. Trigenics is a neurological treatment system that resets the communication between your brain and your body. It instantly decreases pain. It will decrease inflammation, increase flexibility and strength and range of motion, and it assists in tissue healing. Now, I want to go over the origin of many people's knee pain. The origin of the knee pain is usually not started in the knee itself. It starts up in the neurokinetic chain in the lumbar spine, so the nerves up in this area. And what I've done is I've traced out two important nerves that control pretty much all the function of your knee. So let's start with the black line that I outlined here. This is your femoral nerve, and your femoral nerve runs down into your thigh. It controls the vastus lateralis muscle, your rectus femoris muscle, and your medialis muscle that runs on the inside. What does that mean? Well, all the function, when you lift your leg up to take a step and extend your leg by straightening your knee out, this is the nerve that's controlling all that, and these are the muscles that actually do the work. The other important nerve to know about is your sciatic nerve. Your sciatic nerve runs down your thigh, and it starts up in your lumbar spine here, L4, L5, runs down. It actually becomes a nerve called the popliteus muscle. It's a small muscle right below the knee. It's about that big, and what it does, it unlocks your knee every time you take a step. So these two nerves have to be functioning properly in order for your muscles to work properly and for your knee to move properly. What happens is if you have damage at the nerve root level, and I brought a specimen out here to show you. This is a picture of two vertebrae on top of each other, and if you look closely, you can see the damage happening to that nerve, and I'll compare that to what normal is supposed to look like. A normal space for that nerve should look something like this. You can see the nice opening there, and I'll even give you a light effect there. That's what it should be like. Well, when that nerve closes down, or the bones close down on the nerve and continue to cause damage, that's what happens. So you get a noxious or painful stimuli coming out of that nerve root. Well, these two nerves are going right into the leg through the two nerves that I mentioned and run down into the muscles that control the knee. What happens is you have a state of hypotonicity, meaning you lose tone. The tone drops in the muscles that are controlling how the knee works. And when that happens, over time, it can be 5, 10, 15, sometimes over 20 years, that knee joint, instead of moving and articulating properly, it starts to get sloppy. And when the joint starts to get sloppy, you start to get scar tissue and you start to get a lot of pain. So what we do here in the office is we correct the communication between your brain through the spinal cord, across the nerves to the muscle around the knee to restore tone. So instead of having a sloppy functioning joint, we get it to move instantly the right way. So now you have a joint that's moving the way it should move because you change the tone in the muscles. Muscles are tightening and strengthening, and they're lengthening when they should. So that's a brief explanation of what we do for chronic degenerative knee pain. I'll follow up with some additional questions that people have. If you or a loved one are suffering with chronic degenerative knee pain and you've been told that the only solution is injections, and when the injections don't work that you're going to need to get a full knee replacement, please take down my phone number, give us a call. We guarantee results in 2 visits, or we don't take you on as a patient. God bless you, and I hope to meet you soon.